In today's healthcare conversations, the term price transparency is used in different ways. It's important to know that there are two major rules that govern price transparency: the hospital price transparency rule and the transparency in coverage, which were both issued by CMS. Now, both of these rules were implemented to help consumers make more informed decisions about their health care by providing clear information on costs and coverage, encouraging competitions amongst insurers, and potentially reducing the overall healthcare expenses. However, the original audience, the patients, aren't the only ones using this data. You now have providers, health plans, investors, and self-funded employers also gaining access. Consultants who work with these entities are certainly interested in this data as well. Before we dive into how each one of these groups can use the data, let's provide some context around each rule. The hospital price transparency rule, which is what most people think of when they talk about price transparency, came out on January 1, 2021, with the purpose of making hospital pricing more transparent in order to help the patients understand the cost of care and make more informed decisions. Under this rule, hospitals must publicly disclose a comprehensive list of their standard charges for all items and services. This includes the list price, which is often called the charge master rates, and the negotiated rates with insurers. Hospitals must provide this information in a machine-readable format, for example, a JSON file or an XML file, for easier access and analysis by third parties. Hospitals must also offer a user-friendly online tool that allows the patient to search for and compare prices for specific services and procedures. This tool is required to estimate the out-of-pocket costs based on the patient's insurance coverage. So in essence, the patient is getting a menu of services that they can now shop for and price, say an x-ray for a broken wrist after a ski fall, and then see what those services at the local different hospitals will actually cost given their insurance. The transparency and coverage rule was phased in a year later, starting in January 1 of 2022, with additional deadlines extending into 2023, with the purpose of increasing transparency in health insurance plans. Now, it does provide this information and costs for the top covered medical services. Health insurance and group health plans must also provide a published detailed information of the machine-readable files. This includes the negotiated rates with in-network providers and the allowed amounts for the out-of-network services. The key component here is that insurers must offer the online tools that allow the consumer to estimate their out-of-pocket costs for specific services based on their individual insurance plans. Insurers are required to provide an explanation of benefits that estimates the cost of services and procedures before they're provided, thereby helping consumers understand their financial responsibility up front. Together, these rules aim to enhance transparency within the healthcare system, reduce the all too common medical surprise bills, and empower patients with the information that they need to manage their healthcare costs more effectively.